Well, there was a real fear that hospitals would be overwhelmed by the number of coronavirus patients. Thankfully, those fears were never realized here in Cincinnati, and some hospitals have actually had to lay off and furlough employees because the hospitals are simply empty. Dr. Jennifer Manders joins us live via Skype this morning to talk about what the Christ Hospital is doing to get ready to resume all of those elective surgeries. Good morning, Dr. Manders.
Good morning.
So tell us a little bit about what you guys are doing. I know that a lot of those surgeries were canceled. I've heard from a lot of people that the Christ Hospital it's basically like a ghost town right now. So what's going on at the hospital?
Well, we have had steady business. Unfortunately, we've had to take care of people who have been sick with coronavirus. And then, of course, there's everybody who continues to have the usual. People get sick, come in, have babies, all sorts of things. So it's been difficult because we've had to deal with a healthcare crisis and an economic crisis at the same time. Our CEO has recapped that pretty well in his description of what we're dealing with.
Yeah, and I know that elective surgeries, obviously, those procedures are a big part of what hospitals do. You know, not everything that you guys do is a crisis. So how big of an impact has that had, just having all of those surgeries canceled?
Well, I mean, I would say the operating room is pretty much what drives our business and helps keep the hospital going. So the fact that we've had to shut that down has had a significant financial impact on the hospital.
So as of Monday, you guys are probably going to have more of those procedures resuming. I know I spoke with Dr. Henry and Dr. Kyriakis a couple of weeks ago, and they said that they were fearful that people weren't coming into the hospital for treatment for things like heart attacks because they were afraid of catching COVID-19, which I just thought was stunning. What are you guys doing to reassure patients that it is indeed safe to come to the hospital if you need treatment?
So we're doing everything we can to keep our patients safe. We have screening at the door. We take everybody's temperature as they come in to make sure they're not exhibiting any symptoms. We screen them with questions. And then everybody in the hospital is wearing masks. We've kept all of our COVID patients sequestered in one area of the hospital and have really made efforts to keep everybody else safe. The patients and the staff and our community safety is actually our utmost priority. So as we move towards moving into more elective cases, we're testing everybody for COVID-19 who's going to undergo any elective procedures or any elective surgeries. We're using all the appropriate protective equipment, PPE, in the operating room for all of the staff. And we've had a lot of work towards just sending these patients home on the same day of surgery so that we don't have people having to spend the night in the hospital.
All right, great. Well, thank you so much, Dr. Manders, for joining us this morning. We really appreciate it.
Thanks so much.